Hey guys, so today we will be seeing this basic revision of one-liners from the respiratory chapter. First question, the residual volume is approximately how much? The answer is 1200 ml or 1.2 liters. You have to memorize that graph and each value, tidal volume, inspiratory volume, expiratory volume, FRC, everything you have to memorize. So this question is oftenly asked from the chart, that is residual volume is approximately 1200 ml. Second question is the gold standard for measuring FRC. See, FRC can be measured from different methods like helium dilution technique, balloon technique, etc., etc. But the gold standard is body plethysmography. Third question, compliance in a 30-year-old adult intubated patient. So each word is important here. 30 years. So normal age, adult individual, and the patient is not spontaneously breathing, the patient is intubated. So as you all know, compliance can be static compliance and a dynamic compliance. And this static compliance further and dynamic compliance during breathing can be further divided into spontaneously breathing patients and intubated patients. If you see a compliance of an adult male in a spontaneously breathing patients, it is usually 50 to 150 ml per centimeter H2O, and in an intubated patient, it is 50 to 100 ml per centimeter H2O. Whereas in female, it will be little bit less, 30 to 40 to 100 ml per centimeter H2O. So the question asked is a compliance in a 30-year-old adult intubated patient is 50 to 100 ml per centimeter H2. So next is, what is oxygen flush? So in this question, they usually ask just the normal value. They won't give any context about it. You should just memorize the normal value, that is 1000 ml per minute. If you go into your physiology, you will know that oxygen flush is equal to content of the oxygen into the cardiac output. As we all know, cardiac output is 5 and the content of the oxygen is 20, and if you make it into ml, the oxygen plus the final value will be 1000 ml per minute. So the next question is, sigmoidal shape of the oxyhemoglobin dissociation curve is due to. So we know So oxyhemoglobin dissociation curve is usually like this. So the saturation 100, it will be like this at a PO2 of 100. And when it decreases to 90 and 80 and 60 and so on, the oxygen hemoglobin dissociation curve reduces in a sigmoidal shape. So they are asking, what is the reason for this sigmoidal shape? So this was asked in my NEET SS. So the question was not a direct onliner like this. There were 4 choices and we had to choose which one of the options were true. So the answer which was true is the answer for this question also. So we will see why it is sigmoidal shape. So basically this hemoglobin is a tetramer and it has 4 heme units. So each heme unit will bind to each oxygen. So it has 4 oxygen binding units. So when one oxygen comes and binds to the first unit, the cooperativity of the hemoglobin to bind to the next oxygen is much more. And further to the third and the fourth oxygen is even much more. This gives the sigmoidal shape of the oxygen hemoglobin dissociation curve. So the answer for this question is the sigmoidal shape of oxyhemoglobin dissociation curve is due to cooperativity of the hemoglobin. Similarly, when the oxygen leaves the hemoglobin, when the first oxygen leaves, the affinity decreases for the next to second, third, and fourth oxygen to leave the hemoglobin molecule. So it is a reversible curve, and the sigmoid shape of the oxyhemoglobin dissociation curve is due to cooperativity of hemoglobin. So this oxyhemoglobin dissociation curve, you read in and out about this topic, because without this topic, one can't form a NEET SS or INI-SS question paper. So this topic is very, very essential if you're cracking any entrance exam related to anesthesia. Thank you.